Hi there, my name is Preet. I'm a mother of 3 and women's health physiotherapist at Embrace Physiotherapy. I became a first-time mum in May 2013 and remember one of the first questions I asked of myself was, why didn't somebody tell me? According to research, 50% of women will suffer from back pain in pregnancy. Due to childbirth alone, approximately 30% of women will suffer from urinary incontinence, and 1 in 10 will suffer from fecal incontinence. Furthermore, about 35% of women will suffer from dyspareunia or pain with sex in the first year following childbirth. I quickly realised I was not alone. As I navigated my postpartum journey, I quickly realised there was a lack of evidence-based practice care and women of Singapore deserved better. In 2019, Embrace Physiotherapy was born and built on the philosophy that women who know better do better. International guidelines recommend that women work with a women's health physiotherapist in their postpartum recovery. And let's face it, after attending the 6-week gynae check and being given the all clear to exercise can leave women feeling a little vague regarding this statement. Questions such as where to start, what to do, are often what we hear from our patients. This is an example of where working with your women's health physiotherapist can be of help. We provide postnatal assessments to our patients that are looking for more structured advice to support them in their vaginal or C-section recoveries. We help address and provide conservative management strategies to cover concerns including but not limited to incontinence, prolapse, caesarean section scar care, addressing concerns around perineal tears and trauma including episiotomies, guidance on activities that may be limiting your ability to progress forward in your recovery, address pains anywhere, and also diastasis recti. We also support our women through lactation physiotherapy services. It could be a matter of weeks or months for some of our patients as we take into consider our patients' concerns or goals. Unless a patient has a particular concern or desire to be seen earlier, typically women commence their postnatal journey with us at the 6-week mark. If I can simplify this journey, it would be stage 1, addressing any specific trauma, dysfunction and pain. Stage 2 is focusing on connecting with your core. That includes diaphragmatic, pelvic floor and abdominal wall function. As they say, you don't build a house without a foundation. Your core is your foundation to help you move forward in your pathway to achieving your goals. Stage 3 is progressing you to do more challenging and functional movements that mimic your day-to-day life, be that running after a baby to climbing that mountain. Stage 4 is about maintenance. Once our women have achieved their goals, we want to ensure that they keep continuing to do the things that they love and embrace life. It is Kegels for life, but it may not be every day. As they say, prevention is better than a cure. It is important to note that there doesn't need to be a problem in order to see a physiotherapist specialising in women's health. Sometimes it's just good to know where you are at, what you may need to do, or just knowing that you are doing the right things and headed in the right direction. However, we understand that sometimes life can get in the way. It's never too late to seek the advice and reap the benefits of a consultation with a women's health physiotherapist. Yes, we are strong believers and will always encourage women to start their journey during pregnancy. For pain management, we know that pain can negatively impact our quality of life and can also affect our simple day-to-day tasks such as sleeping and getting out of bed. It is important to know that pain is common, however not normal, and help is available. For exercise advice and guidance, we often see women not meeting minimum exercise guidelines of 30 minutes, approximately 5 times a week, and 2 days of strength training. At Embrace, we are able to individualise a program for you or progress and modify your exercises to your needs. This is also supported with our group prenatal exercise classes. We can also work with our patients to help prevent urinary leakage or help address any bladder or bowel leakage during pregnancy, which leads me on to having your pelvic floor assessed and learning how to do your Kegels properly. We know that up to 50% of women will incorrectly perform a pelvic floor contraction when verbally instructed. Pelvic floor exercises or Kegels may not be indicated for all pregnant women. This is best assessed and managed with your women's health physiotherapist. For birth preparation, did you know that the pelvic floor has to stretch 300% in order to birth your baby? Can you imagine your calf muscles stretching 300%? Whilst our bodies are amazing, there are strategies you can work on with your women's health physiotherapist to help reduce your risk of perineal trauma, shorten labour times, and hasten your recovery from your childbirth experience. For abdominal wall assessments, we know that by 35 weeks of pregnancy, almost 100% of women will be experiencing diastasis recti or abdominal wall separation. Some women may further notice that there is a doming or tenting of their abdomen, and this can be an indication of excessive pressure or tension in the abdominal space. Working with your women's health physiotherapist can help to identify the dysfunction that may actually exacerbate your diastasis recti during pregnancy. Having an idea beforehand of what may come can help better prepare you physically and mentally for what lies ahead. As we all know, that early postpartum period can be a whirlwind of sensations and experiences and can be trying with new routines on hand. Working with your women's health physiotherapist in pregnancy may help to alleviate some of the stress associated with this dynamic period, but also help to keep you informed of what may come and how to manage.